Greetings and welcome to our presentation entitled Persons with Long COVID and Job Placement, What Rehabilitation is Reported. I am joined by a team of presenters who will introduce themselves shortly. My name is John Walsh. My pronouns are he, him. I identify as a white cisgender male, born at the tail end of the baby boomer generation. I am wearing a light blue button-down dress shirt and a gray sports jacket. I am also wearing black rimmed glasses and a Bluetooth headset. My Zoom background is virtual and it is blue with the George Washington logo. I work at the George Washington University and have the pleasure of serving as the project director for the Center for Innovative Training in Vocational Rehabilitation. I'd like to first acknowledge that the contents of this presentation were developed with support from the Innovative Rehabilitation Training Program funded by the Rehabilitation Services Administration at the U.S. Department of Education. The information contained herein does not necessarily reflect the policy or position of the U.S. Department of Education, and no official endorsement should be inferred. Before I turn it over to our presentation team, I wanted to take a few brief moments to give you an overview of the work of the Center for Innovative Training in VR, or CITVR. First of all, the best way to gain access to our training products is to visit our website at trainvr.org. This slide shows a series of logos of our partners in this project. The George Washington University is the lead in partnership with the Inner Work Institute at the San Diego State University, the VR Development Group, the Employment Resources Incorporated, and the Council of State Administrators of Vocational Rehabilitation. The purpose of the innovative training grants is really to develop innovative methods to train VR personnel working in state vocational rehabilitation agencies to ultimately improve service delivery and improve employment outcomes for individuals with disabilities. With that in mind, our three primary goals at CITVR are that we develop training products that will really help facilitate this more effective delivery of rehabilitation services to individuals with disabilities. We then want to demonstrate the effectiveness of these training products and build upon them. And finally, we want to develop training modules to supplement existing rehabilitation counseling programs and in-service training programs. So let me talk a little bit about some of our activities we are doing to achieve these goals. Our first initiative was the VR 101 training cohort. Personnel from 10 state VR agencies were granted access to the VR 101 training modules developed by the VR Development Group. These modules contain 15 hours of content, providing a comprehensive overview of the VR process in public VR agencies, from application to case closure. During that 2-year period, over 2,000 personnel were enrolled in this project. In addition, our partners at the Inner Work Institute at the San Diego State University also developed customizable training modules that mirrored much of the content in the VR 101 modules. These modules can be adapted based on the needs of the agency and branded with their agency logo. These modules then become their property that are part of the cohort, thereby providing them a tool that is usable after the grant cycle is over. Feedback from our cohort members have indicated that these modules have been valuable onboarding tools and also provide a means for upskilling existing staff, especially in a time where many state VR agencies are experiencing challenges in recruitment and retention. Our website, also at trainvr.org, provides a portal to all the other training products we have developed during the almost 5 years of this grant. You can also gain access to our online community that is hosted on a social media platform. Our training library hosts numerous free, on-demand webinars that offer CRC continuing education hours. We also curated our training library by learning paths that are based on topic and job role. We also host or co-host a number of communities of practice, and some of them are related to topical areas such as supported employment, rapid engagement, pre-employment transition services for blind, visually impaired, and deafblind students, and training coordinators, directors, community of practice. We also seek to continually learn of the needs of our community and perform assessment activities to learn more about the training needs for current professionals and those who prepare to enter the field, including a training needs survey of state VR agencies and also a rehabilitation counseling curriculum academic survey. Now, most recently, we also performed a national long COVID survey, which is going to be the topic of this presentation. We also just released a training utilization survey to assess how professors at rehabilitation counseling programs have utilized our training, along with current students and recent graduates, to assess how these training products are being utilized and the areas of need for future development for these target populations. So again, the topic of today's presentation relates to the survey results of our long COVID survey. Before we have our presentation give you those findings, I also wanted to make you aware that our team developed a virtual mini conference that we had presented live in January of last year to share information on the implications for VR professionals serving VR participants that are impacted by long COVID. We recorded the 2.45 hours of content and posted them on our website. We were fortunate to have a series of partners in developing this webinar series. And in this slide is a series of logos of our partners, which included the Centers for Disease Control and Prevention, the Job Accommodation Network, Yes LMS, and the Vocational Rehabilitation Technical Assistance Center for Quality Management. The 5 training sessions in these series include from epistemology to clinical care, psychosocial issues and the provision of VR services, legal and service delivery dimensions, accommodations in the workplace, and the stigma of long COVID, ethical implications for VR professionals. On this slide, we provided a QR code and URL address for easy access of this training series and hope that you access to gain this additional information. Now, I will turn it over to Dr. Tichy to introduce herself and also review our learning objectives for today's session and begin our formal presentation. Dr. Tichy?
Hi, thanks, John. Hello, everybody. As John mentioned, my name is Dr. Nichole Tichy. My pronouns are she, her. I identify as a cisgender white female who is also a millennial. And today I am presenting from my home office in Winchester, Virginia. I have a blurred background of that home office. I also have blonde hair, glasses, and I'm wearing a blue blazer. So as John mentioned, I'm going to kick this off by kind of introducing the learning objectives for this presentation. And so by the end of this presentation, we really hope that participants will be able to describe long COVID and how long COVID meets the ADA disability criteria. We also hope that participants will assess their experiences of placement of persons with long COVID and compare to survey respondents' reported behavior belief themes addressing advantages and disadvantages to placing people with long COVID, normative belief themes addressing persons of influence, and control belief themes addressing facilitator and barriers to placement of persons with long COVID. And finally, we hope that participants will be able to examine the study findings for utility when providing vocational rehabilitation services and advocacy services to persons with long COVID. Next slide, please. So before we get started, it's pretty important to know and have kind of a working definition of what it means to have long COVID. There are multiple definitions, and one of the things that I want to share in terms of the framing of long COVID is that this was the first diagnosis that was initially identified through social media. And so initially on social media platforms such as Twitter, individuals started experiencing COVID-related symptoms that lasted longer than that initial 2-week period. And so the US Department of Health and Human Services has issued the following as the official working definition of long COVID. Long COVID is broadly defined as signs, symptoms, and conditions that continue or develop after initial COVID-19 or SARS-CoV-2 infection. These signs, symptoms, and conditions are present 4 weeks or more after the initial phase of infection. May be multisystemic, meaning that they cover multiple bodily systems, and may present with a relapsing, remitting pattern and progression or worsening over time, with the possibility of severe and life-threatening events even months or years after infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. Next slide, please. So with this definition being relatively broad, one of the things that has been a bit of a challenge in terms of understanding not only the diagnosis of long COVID, but the prevalence of long COVID is that many of the numbers and the demographics are often estimated. We'll get in a little bit later in talking about some of the symptoms, but in terms of diagnosis, there isn't one specific test or scan that can be utilized to confirm a diagnosis of long COVID. And for many individuals who experience long COVID symptoms, may have had what was known as asymptomatic COVID-19, meaning that they did not initially present with symptoms of COVID-19, but have now started to experience these lasting effects. As of February 2024, there is an estimated report of 17% of US adults having reported experiencing symptoms of long COVID, with that estimating to about 45 million people. Additional surveys report, and this is from 2022, indicate that 6.9% of adults reported ever having long COVID, with adult ranges from 35 to 49 being the most commonly reporting the symptoms of long COVID. From 2022 to 2024, that's a significant increase as professionals and medical doctors and other individuals are becoming more aware of long COVID and the presenting symptoms. Additional presenting concerns in terms of information gathered from these different reports noted that adults with family incomes at 400% or more of the federal poverty level were less likely than those with family incomes at 200% to 399% to ever have or currently have long COVID. Additionally, the percentage of adults who ever had long COVID was lower in large central metropolitan areas compared with medium and small metropolitan or non-metropolitan areas. Current long COVID was lowest in large central metropolitan areas. And this kind of makes sense as, rehabilitation counseling professionals, and we'll get into some of the barriers and facilitators for services later. But one of the things is that we know that large metropolitan areas likely have more resources, more access to resources compared to individuals living in rural areas. Next slide, please. So as I mentioned in the definition of what is considered long COVID, the CDC presents with a variety of symptoms that can be identified. One of the things that I believe that is important to highlight is that over 200 different symptoms have been identified being related to long COVID. And so this really demonstrates the multisystemic concern that is related to long COVID. So while this is not a comprehensive list, it's noted that some of the symptoms mentioned can often resemble symptoms of other conditions, such as an invisible chronic illness like chronic fatigue syndrome, which can make it difficult to explain to professionals. But some of the common general symptoms include tiredness or fatigue that may interfere with an individual's daily life, experiencing symptoms that get worse after physical or mental effort. So we hear individuals experiencing what is called post-exertional malaise, meaning that fatigue gets exacerbated after doing different types of activities. Fever, respiratory and heart-related symptoms such as difficulty breathing or shortness of breath, neurological symptoms. One of the most common symptoms of long COVID has often been reported as brain fog, digestive symptoms, and then a wide variety of other symptoms. And so this really highlights the multisystemic aspect of long COVID, but also in terms of the relapsing remitting aspect of long COVID, many individuals may experience a variety of symptoms over a period of time. So for a period of time, they may experience the chronic fatigue that might get better, and then it comes back, or they start to experience new symptoms. And so that's really important information when working with individuals or advocating for individuals who are presenting with symptoms of long COVID. Next slide, please. In July of 2021, long COVID was covered under Section 504 of the Rehabilitation Act of 1973 as amended, and the Americans with Disabilities Act, qualifying as a physiological condition affecting one or more body symptoms, and can qualify as a disability if one or more major life activities are substantially limited. And this information comes directly from the US Department of Health Services. And it aligns with the Americans with Disabilities Act in terms of how the definition of disability is presented, which states that a disability as the inability to perform any substantial gainful activity due to a medical or physical impairment or impairments which can be expected to result in death or which has lasted or can be expected to last for a continuous period of not less than 12 months. And so a variety of guidance has been provided in terms of how long COVID qualifies as a disability. And in some of my experiences as a professional, one of the stories that I have heard in terms of long COVID and qualifying as a disability is that a previous restaurant owner and chef acquired COVID-19 and initially lost their sense of smell and taste. And this lasted for a long period, about a year. And so this individual could no longer perform the essential functions of their job because they could no longer taste or smell the food that they were preparing in their restaurant, which, substantially impacts their ability to perform any kind of gainful activity. Next slide, please. And so in talking about that individual in particular, their employment experience, much research is coming out in terms of how long COVID is impacting employment and for people who are experiencing symptoms of long COVID. And so Perlis et al. 2023 report from a sample of more than 15,000 individuals who reported positive cases of COVID-19 and noted experiencing post-COVID conditions or long COVID were more likely to experience unemployment and less likely to be employed full-time. Therefore, many individuals were not able to return to their full-time work and might have returned to part-time work. And so with this, additional sources have noted the significant impact on the workforce, and that some reports suggest that 10 to 35 million working age adults in America have long COVID, and that the Bureau of Labor and Statistics reported that there are over 11 million job openings for December of 2022. Additional resources, such as the National Conference of State Legislators, acknowledges multiple sources discussing the impact of long COVID on the labor force, reporting, again, a significant labor shortage, but also noting that there are more than 9 million unfilled jobs and 5.8 million people seeking employment. And so this becomes significant in terms of vocational rehabilitation professionals and supporting individuals who are experiencing symptoms of long COVID, which is why, next slide, please. The Center for Innovative Training launched the Long COVID survey. And so now I'm going to switch a little bit and kind of focus on discussing some of the research questions and the methods in terms of the dissemination of this survey. Next slide, please. So the objective of the study was to better understand the beliefs of vocational rehabilitation professionals toward placing persons with long COVID into jobs. So the overarching research question for this particular presentation, in which we're going to address vocational rehabilitation professionals' intention to work with persons with long COVID, is influenced by their beliefs about COVID-19, the influence of others, and perceived barriers and facilitators to placing persons with long COVID into jobs. And so some of our identified hypotheses included beliefs toward placing persons with long COVID into jobs are influenced by their reported advantages and disadvantages of placing persons with long COVID into jobs. Additionally, beliefs toward long COVID are influenced by those persons identified as who they think should or should not place persons with long COVID into jobs. And finally, beliefs toward long COVID are influenced by identified facilitators and barriers to placing persons with long COVID into jobs. Next slide, please. So the process in terms of the dissemination and development of this particular survey, 1 week after the long COVID mini conference supported by the Center for Innovative Training and Vocational Rehabilitation, the CITVR team met to discuss a research study addressing the placement of consumers with long COVID into jobs. This particular team consisted of 5 certified rehabilitation professionals, developed a draft survey in order to explore the placement of persons with long COVID into jobs. 3 open-ended free response format questions based in the theory of planned behavior were created. The questions were identified as the following. Please list any advantages and or disadvantages of placing a consumer with long COVID in a job. When you consider placing a consumer with long COVID in a job, there may be individuals or groups of people who think you should or should not place this consumer into a job. If such individuals come to mind, please list them. And then the final open-ended question, is there anything that would help you or facilitators or hinder you, barriers, in placing a consumer with long COVID in a job? Next slide, please. So in terms of survey development, participant selection was based on 2 very specific criteria. We focused on individuals who are currently providing placement-related services in a vocational setting, and they have or have had an active caseload. In terms of face and content validity, to ensure that the questions developed as part of this survey were measuring what we intended to measure, we had 2 expert panels. One consisted of members from the George Washington University Department of Counseling, Human and Organizational Studies, with members consisting of 2 rehabilitation counseling faculty members who held the CRC credential and had experience placing individuals with disabilities into competitive integrated employment, and then members from the SIT VR. And so specifically 3 members who held the CRC credential and again, experience placing individuals with disabilities into employment. Next slide, please. And so the dissemination of the survey through the GW Center for Rehabilitation Counseling, Research and Education. In December of 2022, the SIT-VR sent out an email to invite persons on the SIT-VR mailing list to first view a pre-recording webinar addressing long COVID and the provision of vocational rehabilitation services between January 1st, 2023 and December 31st of 2023. And secondly, provided a link for the opportunity to participate in a voluntary, optional, anonymous 50-question survey to explore vocational rehabilitation professionals' beliefs about long COVID. When a person clicked on the optional anonymous link, SIT-VR long COVID informed consent was presented and provided the opportunity for participants to either agree or disagree with consent to participating in the survey. Upon agreement and consent to participation, participants access the survey with the option at the end to complete another survey in order to receive CRC credit. Participants were also potentially eligible to enter their email address for a $75 Amazon gift card. Again, in terms of anonymity and making sure that responses were kept anonymous, different survey links were embedded within the initial survey and would take participants to different sites to ensure that their responses and email addresses were not linked to their initial survey responses. And now I'm going to turn it over to Dr. Ken Hergenrather.
Thank you, Dr. Tichy. I'm Dr. Ken Hergenrather. I am a rehabilitation counseling faculty member at the George Washington University, the co-director of the George Washington University Center for Rehabilitation, Counseling, Research, and Education, and a member of ARCA. My pronouns are he, him, and his, and I am providing this presentation from my office at the George Washington University. My background is blurred. I am a 63-year-old male, white, gray hair, average build. I'm wearing a blue sports coat and a green and white and blue checked shirt. I'd like to talk about the theory of planned behavior. So the theory of planned behavior by Edgison and Fishbein suggests that a person's behavior is a function of one's beliefs, and these beliefs include the behavioral beliefs, normative beliefs, and control beliefs. And the theory of planned behavior, as of 2020, there were more than 4,230 published manuscripts. This renders the theory of planned behavior as one of the most applied theories in the social and behavioral sciences. Next slide, please. This is a diagram of the theory of planned behavior from Edgison, 1986. On the left side of this diagram, you will see belief statements. And these belief statements of the theory of the planned behavior are what the survey addresses. From belief statements, these will influence the attitude toward performing the behavior. They'll also identify the subjective norm, the people who are important and influential, and also the perceived behavioral control, which would be those beliefs about the facilitators and barriers to performing the behavior. And these are correlated with intention to perform the behavior and the performance of the actual behavior. Next slide, please. In regard to the theory of planned behavior, behavior is actually the transmission of the intent, the behavioral control, and an action. The survey addressed the placing of persons, consumers with long COVID into jobs. The behavioral intention is influenced by the individual's attitude, which is the beliefs of the advantages and disadvantages of performing the behavior. The subjective norm, which is identified as those persons who think the individual should or should not place a consumer with long COVID in a job. And perceived behavioral control, which addresses one's beliefs as to what the facilitators for placing a person with long COVID in a job and the barriers to placing a person with long COVID into a job, what those beliefs are. Next slide, please. In regard to the attitude, subjective norm, and perceived behavioral control, attitude is consisted of behavioral beliefs. And so these, again, are the beliefs of performing the behavior. The subjective norm is really identified as the influence of the social pressure as perceived by the individual, identifying people or groups of people who think that the person should or should not perform the behavior. And then perceived behavioral control includes the control beliefs, which are these facilitators for or barriers to performing the behaviors. Each of the beliefs in the complete model are evaluated. For the purposes of this research study and the presentation today, we are doing the first step of the theory of the planned behavior, which is eliciting salient beliefs from persons most likely to perform the behavior. Next slide, please. The theory of planned behavior, as with all theories, do have limitations. And we just want to state a few of these. And that is that although we don't actively address social locations, personality, demographic variables, and social locations are assumed to impact participants' beliefs within the theory of planned behavior. We also want to report that sometimes participants may not always be rational, and unconscious motives are not considered in performing behaviors. However, the utility of the theory of planned behavior is a deductive research approach, stating a narrow focus, having more meaningful measures as these are elicited from persons performing the behavior, and there is analysis by construct, which would include the attitude, subjective norm, and perceived behavioral control. Next slide, please. If we look at our sample, so we'll begin the exciting part of the study in regard to the results. So the information regarding our sample, we had 699 participants. Of these, 74.4% were certified rehabilitation counselors. Of these, 84% worked in public VR, and 52.6% identified as counselors. In regard to COVID, of the participants, 20.9 reported that a family member had long COVID or has. 36.8% reported that a friend has long COVID, and 29.1% reported that a coworker has long COVID. An interesting point to acknowledge from the data is that in regard to long COVID training, only 46.1% of participants have completed a long COVID training. Next slide, please. In regard to the analysis, so the analysis of the data of the beliefs was in accordance with the theoretical guidelines. And what was done is we determined the modal beliefs for each of these areas, that include the behavioral beliefs, the normative beliefs, and the control beliefs. We looked at these responses, which in total were 1,399. And we put these into broad categories. We grouped these by similar beliefs. And these were grouped within the analytic category, such as the behavioral belief, the normative belief, and the control belief. And we use the exact written words. And at this time, I will now turn this over to Chen. Chen. I will turn it over to Chen.
Thank you, Dr. Hergenrather. My name is Chen. I am a Chinese international doctoral student in the mental health counseling program at George Washington University. I am wearing my blue cardigan. I am wearing my black glasses, and I am also black hair female. She, her pronouns. My blurred background indicated that I am at my student apartment very comfortably. So I'm going to present our analysis of the findings framed within the theory of planned behavior. So among all the responses, we collected answers regarding the advantages to placing a person with long COVID to employment took up about 1/3, and 2/3 of the answers addressed disadvantages. Like Dr. Hergenrather mentioned, theory of planned behavior suggested that when significant behavioral beliefs are positive, it implies that the individuals have a favorable view of that behavior and are more inclined to engage in it. Conversely, when these beliefs are viewed negatively, it suggested that the individuals hold an unfavorable opinion of the behavior, making them less likely to engage in it. In such cases, it's recommended to investigate the negative beliefs to understand how they can be addressed and to advocate positive beliefs. Next slide, please, Dr. Walsh. Thank you. Here is a breakdown of the model behavioral beliefs on the placement of persons with long COVID in employment, both positive and negative. It stood out to us that two beliefs about the barriers to job placement, which are limited knowledge and long COVID symptoms, they constitute 61%, 61.5% of the response answers, while other beliefs, which described more advantages, represented about 1/3 of the responses. Next slide, please. Thank you. About 97 responses indicated that, identified that long COVID symptoms hinder job performance. These symptoms include fever or chills, cough, and fatigue, alongside lesser known signs such as new loss of taste or smell, sore throat, and diarrhea. It's important to note that this list isn't exhaustive, and symptoms may vary from person to person. As new variants of COVID-19 emerge, the landscape of symptoms may evolve. The CDC continues to monitor and update their list to reflect these changes for individuals remain informed. We can go to the next slide. Thank you. All right. About 15.4% of the responses describe the belief that a person with long COVID is capable of working with appropriate accommodation. Reflected in some of the recent research, accommodations may look like modifying return to work policies, referring to long COVID support groups, listening to the client's needs, providing support and flexibility to employees with long COVID in terms of their workload and remote work options. Next slide, thank you. And having employment can increase a person's well-being was a belief identified by about 8.3% of the responses. This is evidenced by previous research. Adams in 2019 highlight the correlation between well-being and both health outcomes and worker productivity. This suggested that individuals who prioritize their well-being are not only likely to experience better health, but also tend to be more productive in their roles as employees. Moreover, Salgado and their colleagues in 2019 have found a significant correlation between employee well-being and performance at work. This also addressed the importance of nurturing a positive work environment that supports the well-being of employees, as it can directly impact their ability to excel in their roles. Next. Thank you. Professionals have identified 4 normative beliefs. This describes the influential role of others in the decision-making process and suggests the impact of social influences on their ability to place individuals with long COVID effectively. According to Jason and his colleague, individuals often form attitudes towards behaviors based on their perception of whether the reference, such as peers and colleagues, support or do not support those behaviors. In the context of rehabilitation placement, this implies that professionals may hold favorable attitudes towards placing individuals with long COVID if they perceive support from their peers or colleagues. And conversely, they may hold negative attitude if they may not hold a positive attitude if they perceive a lack of support. Oh, we can go to the next. Thank you. Here is a breakdown of some mostly mentioned normative beliefs from all the responses. About 3/4, 74.7% of the responses reported influence from their family, friends, coworkers, and supervisors who shape their beliefs in working with persons with long COVID in employment. About 22% reported their clients who may have experienced long COVID or share their input about long COVID can impact their work in placement of persons with long COVID. Employers or organization that work with them also was reported as an important influence. We can go to next. Thank you. This finding is also consistent with previous research that looked at work with persons with other physical or mental conditions such as HIV/AIDS or major depression disorders. Next. The third important component of the theory of planned behavior addresses modal control beliefs. This encompasses both internal and external factors that can influence behavior. Internal factors may include personal skills, abilities, and resources, while external factors may include environmental constraints or facilitators. When modal control beliefs are identified as impediments, people are less likely to successfully perform the behavior when confronted with such impediments. The fewer the resources and opportunities individuals believe they have to perform a behavior, the lower the likelihood that this behavior will be performed. And here we have about 269, which is also 65.7% of the responses that address facilitators to placement, and about 20.3% that address barriers to placement. We can go to the next slide. Yeah. And here is a breakdown of the frequently mentioned modal control beliefs reported among the responses. Facilitator in placing a person with long COVID was mostly described as more information and accommodation. Long COVID symptoms and misinformation about long COVID are reported as barriers and impediments here. We can go to the next. And our findings are also in line with the existing research. Again, long COVID isn't a simple condition. It manifests in various ways. It's also a spectrum of over 200 symptoms that can impact about maybe over 10 different organ systems of a human being. Often symptoms come and go, leading to a challenging and fluctuating experience for those who are affected. Misunderstanding, lack of knowledge, and stigma would add another layer of difficulty for individuals dealing with this condition, and also for those who want to understand and support them. Moving on, it's crucial to recognize that individuals with long COVID can still work with the right accommodation in place. About 20.5% of responses highlighted this point. Accommodations might include adjustments to return to work policies, referrals to long COVID support groups, and again, most importantly, listen to the needs of the individual, as emphasized by Wang et al. In 2022, providing support and autonomy to shape workload around fluctuating health status. And long COVID symptoms can present significant barriers to employment, as noted by 13.3% of responses. Research have evidenced this in previous significant diseases and health conditions. Vocational rehabilitation professionals, particularly when dealing with their clients or consumers living with HIV and AIDS, have cited knowledge gaps about the prognosis and the functional limitations as hurdles. According to the research by Dr. Hergenrather and his colleagues earlier, the medical instability of HIV and AIDS is also reported as a barrier, which indicated the importance of understanding the intersectionality of health conditions and vocational placement. And we will turn to Dr. McGuire-Kuletz for the.
Thank you. I am Maureen McGuire-Kuletz, she, her, hers, co-director of the George Washington Center for Rehabilitation Counseling, Research, and Education. Brown hair and glasses, and I'm presenting from Washington, D.C. My background is a logo of the George Washington University, and I am an ARCA board member. So let's pick up and look at some, pardon me, limitations. So in terms of the study and the data, obviously the constructs were developed from a convenient sample, and we elicited salient beliefs that may have limited generalization to public rehabilitation job placement professionals. And sometimes self-reports may not translate into actual behaviors. Next slide. So the study findings suggest that there's 13 factors that impact the placement of consumers with long COVID in jobs. And I'm just going to highlight a few of them. The first is the perceived 2 disadvantages and 4 advantages of placing people with long COVID in jobs. Those are possibly hindering job performance, limited knowledge of long COVID as a barrier to job placement and retention, and increased awareness of long COVID in the workplace. The second is public rehabilitation job placement professionals acknowledge that their ability to place consumers with long COVID is influenced by rehabilitation professionals' family and friends, coworkers and supervisors, consumers and clients on their caseloads, and employers with whom they work. Public rehabilitation job placement professionals identified 2 facilitators and 2 barriers to the placement of consumers with long COVID. Needing more information, understanding that COVID can work with accommodations, seeing long COVID symptoms present as barriers to employment, and long COVID misinformation serving as an impediment to placement. Next slide, please. So what are the implications for rehabilitation professionals? Well, one of the things we know is that VR professionals are requesting information on long COVID, and there is a lack of long COVID information, which is a barrier to successfully placing and retaining individuals with long COVID in jobs. We know that the placement of consumers with long COVID is reported as being influenced by VR professionals' family, friends, coworkers, and employers. But because only 46.1% of the participants attending a long COVID training, it is unsure as to whether VR professionals are obtaining this information. The need for long COVID information is presented as a behavioral belief and repeated as a control belief. And finally, VR professionals know that persons with long COVID can work with accommodations, but they want information on long COVID symptoms in order to better address management for placement and retention. Next slide, please. So long COVID workplace training addressing accommodation considerations. And this comes from the Job Accommodation Network 2022. Job accommodations that are individualized and adaptable work best for employees with long COVID. And that includes flexible scheduling, rest breaks for shortness of breath, brain fog or fatigue, part-time work, compressed hours, variable start and end times, the ability to accumulate hours and take time off when needed, job sharing, telework, for employees who are having trouble sleeping, and a quiet workspace, uninterrupted work time, and access to noise cancellation. Next slide, please. So the benefits of long COVID workplace training. Schaap et al. Reported that after 8 months of management training, supervisees with disabilities were working more consecutive hours and more hours per week. Another report reported that 127 supervisors completed 5 weekly 2.5-hour courses through a mentoring program addressing how to support employees at work with disabilities, and that the supervisors who completed this training did better than those who did not receive the training. The Data Management Employee Coalition reported that 71% of 242 organizations were treating long COVID cases like accommodations for other disabilities using standard procedures. These organizations reported the need for education for employees and employers, education for managers, identification of support groups, flexible schedules, work hardening, and work space and desk modifications. Lowenstein, based on the experience of persons with long COVID in the US, suggested that employers provide education on long COVID to employees, create remote work opportunities and options, job flexibility, and reevaluate paid leave and benefits. Next slide, please. So workplace training on long COVID recommended across the US for state VR agencies. As we know, 41.1% of behavioral beliefs address long COVID information needs. 51.1% of the control belief address long COVID information needs. And 53.9% of respondents reported not attending a workshop training on long COVID. Vocational rehabilitation service providers should advocate at their workplace for long COVID training that, at a minimum, addresses long COVID symptoms and accommodations. Training could be live, recorded, and provided to employers. Training interventions could include persuasive communication, in which the beliefs of rehabilitation professionals regarding the consequences of the placement of consumers with long COVID would be explored and challenged by rehabilitation professionals who have successfully placed a person with long COVID into competitive integrated employment. And I will now hand this back to Dr. Ken Hergenrather.
Thank you, Dr. McGuire-Kuletz. In regard to exploring beliefs, what we propose for rehabilitation professionals in regard to the behavioral beliefs, normative beliefs, and control beliefs is this exploration can be used to enhance case closures. There are a few ways this could be done. According to Bandura, looking at self-efficacy, we'll apply this to long COVID. One, ensuring personal experiences by setting and achieving sub-goals to placing persons with long COVID, such as ensuring that rehabilitation professionals have or are working with a person with long COVID on their caseload. A second item would be observing successes. This is, for example, identifying a rehabilitation professional in the agency who is A, working with a person with long COVID on their caseload, or another who has placed a person with long COVID into competitive integrated employment. A third is to model behaviors of rehabilitation professionals who have placed persons with long COVID into competitive integrative employment. And because there may be some anxiety among persons having an individual with long COVID on their caseload, this could be a result of misinformation. The use of relaxation techniques to control feelings of anxiety associated with working with persons with long COVID and associated with long COVID information. Many respondents reported how someone who has diagnosed with long COVID, if they're in the workplace or the consumer on their caseload, that those individuals could transmit COVID to other persons. And I'd like to say positive reinforcement is an instrument. It's instrumental to changing beliefs. And in changing beliefs increases the person's level of self-efficacy to perform a behavior, such as placing persons with long COVID in jobs. Next slide, please. So in conclusion, with an increasing case rates of long COVID in the US, it's likely that increasing numbers of persons with long COVID will seek employment services through vocational rehabilitation services. So in this study, the theory of planned behavior was introduced as a theoretical foundation from which to explore 1,399 elicited beliefs of rehabilitation professionals on the influencing of persons' placement into jobs of long COVIDs. So the study findings suggest that rehabilitation professionals perceive employment as valued and acknowledge 13 beliefs impacting the performance behavior. These beliefs address the likely outcomes of placement, such as advantages, but it also identified disadvantages of placement and the persons who are influential in their behavior to place. So these beliefs provide evidence of priorities for vocational rehabilitation agencies to further explore when addressing the placement of persons with long COVID into integrative employment and to further advance skill sets of vocational rehabilitation professionals to be successful in the placement of consumers with long COVID. I will now turn this over to John Walsh.
Thank you, Dr. Hergenrather. We want to acknowledge that all of the studies referenced in today's presentation are provided at the end of the slide deck. So we have 3 pages of references that you can review, and where hyperlinks were available to those studies, they are also provided in the reference section. We also provide you in our slide deck with our email addresses. So if you have any additional questions about this topical area or have questions about the work at the Center of Innovative Training and Vocational Rehabilitation, please feel free to reach out to us. I also want to thank you for taking time out of your busy day to join us for this presentation today. Please make sure to check out our other training offerings at trainvr.org. And we want to thank ARCA for giving us this opportunity to present at this Virtual Learning Institute. Thank you for joining us again, and be well.